Now, mental health continues to be a topic of concern, even as we continue to commemorate the May Measurement Month for mental health globally. Millions of people experience symptoms of a mental health condition each year, and the number of people seeking care is trending upward. While a mental health diagnosis may impact an individual's daily life, it can also have a ripple effect across families, communities, and even economies. Today, we delve into a discussion to find out the correlation between mental illness and substance abuse with the help of Dr. Beatrice Kadungu, who is in studio with us. Thank you for joining us, Beatrice. Kindly introduce yourself to our viewers, rather. Tell them who you are and what is it that you do.
Thank you very much. My name is Dr. Beatrice Kadungu. I am a lecturer in the Department of Psychology of Kenyatta University. I am also the director in charge of the Directorate of Accommodation Services. I am a counseling psychology by profession. In addition to that, I am a specialist in addiction studies. I chair the African Regional Chapter of the International Consortium of Universities on Drug Demand Reduction, or ICUDDR. That is a little about myself. Thank you.
Thank you so much for that. You've spoken about you being a director in or rather a partner in the consortium of drug and substance abuse, you've said. So, and that happens to be what we are talking about today, drug and substance abuse and how it relates to mental health. Let's first define this mental health. When do we say that a person is mentally healthy and is mentally unhealthy?
Thank you very much. And I want to begin by saying that just like we say health is not just about the absence of disease, we also say that mental health is more than just the absence of disease. It's about wellness, it's about the quality of life, it's about ability to participate in day-to-day activities as well as contribute significantly to society. So that is really what health is all about. And therefore, when we talk about mental health, we are saying that someone may not be physically having any challenge, but because of challenges that are affecting their mental health, they are not able to live fully. They are not able to significantly contribute to a community. They are not able to live to optimize their potential. Ordinary life issues push them to the edge and sometimes push them out of ability to manage day-to-day occurrences, and therefore we need to step in and do something about it. So that's in really a snapshot what I would say about mental health.
Now, mental disorders can contribute to substance and drug abuse, then disorders arising from that. You've called it the Siamese Twins for this year. How would you describe the correlation to someone who is hearing about it for the first time?
Thank you for that question. Indeed, they say in English, sometimes we use analogies or figurative language to pass a message in a way that people understand. So people do understand the concept of Siamese twins, twins that are conjoined and sometimes have to be separated through surgery. And so the idea is to bring alive to every Kenyan that mental illness and substance use disorders actually coexist. They are almost conjoined. They are related. And I'll explain just a little to give insights about this. For example, a person may be predisposed to having a mental illness. And when I talk about predisposition, I want to take it to the medical world for us to understand better. Sometimes we say people are predisposed to diabetes, predisposed to hypertension, predisposed to asthma. So we're saying people may be predisposed to mental illness, but just like we know with diabetes and blood pressure and asthma, a predisposition is not equivalent to getting the disease. It just means you're more vulnerable. That if you and me expose ourselves to environmental factors that could trigger, yourself who's not predisposed may never get it, but I who's predisposed will get it. And therefore, because of that predisposition aspect, people who are predisposed to mental health may actually use substances, and as a result of using substances through maybe experimentation, through peer pressure, they end up now pushing upwards a disease that would not have come out, would have remained a predisposition, would have just remained subtle. So it pushes it up to make it a reality. And we have seen, the research tells us, there's a big relationship between, for example, use of cannabis and the development of mental illnesses like schizophrenia, which are just examples, and I don't want to get technical. And so that is the one side of it. But on the other side, it has also been found that when people have a predisposition to a mental health, or a mental health symptom is beginning to develop, it can have symptoms such as mood disorders, anxiety disorders. And so people who are having these symptoms seek for a way to self-medicate. So if you have a mood disorder and you take a substance of abuse, it actually lifts your mood. And then that makes you realize, oh, I feel better when I take this substance. And in the process now, they get hooked onto that substance, not because they like it, but because it is self-medicating. And so we say it is like the chicken and egg story. We don't know which came first, the chicken or the egg. So the egg could lead to the chicken could lead to the egg. So that's the relationship between substance use disorders and mental health disorders. And that's what drove our theme for this year's mental health celebrations, not just in Kenyatta University, but in African universities under ICUDDR, to help us think and understand that if we really want to make a breakthrough in interventions, we cannot address either of them alone. We got to put them together and address them simultaneously. Thank you.
You've mentioned the story about we don't know which came first between the egg and the chicken, which brings me to this question. Some organizations say drug addiction is mental illness. Some say drug addiction may increase the symptoms of mental illness. Which is which?
Thank you for that. Actually, it's both plus more. Both plus more, because sometimes when people have a mental illness, and I'll give you some examples. There are people who have a mental illness that has got manifestations such as anxiety. So if the anxiety is high, and by the way, the Global Mental Health Month theme is, it is not just anxiety. That is to tell you, they recognize that a lot of mental illness come with anxiety. Sometimes anxiety as a symptom of the disease itself, in what we call anxiety disorders, but sometimes the anxiety that is associated with any form of mental illness. And so sometimes because of that anxiety, people will begin to use substances to calm themselves down, and that can worsen the problem of the disease and worsen the problem of the substance use. And so finally you end up complicating the matter. Sometimes you find people are put on treatment for mental illnesses, but then they are unable to stop taking substances. And so use of substances causes them not to adhere to the drug treatment. And so that worsens the outcome of the treatment. So that's why I'm saying they are correlated and much, much more. And we shall be having this conversation more in our show on Monday at 8 a.m. Thank you.
Okay, thank you for that response. Now, what are these risk factors that, predispose someone to mental illness?
So we say that there are many. Some of them are genetic, biological, sometimes chemical imbalances in the brain, sometimes they are environmental. And we really say that you can have a predisposition, but a predisposition is not equivalent to having the condition. We need what we call precipitating factors. Precipitating factors are the ones that will trigger something you are predisposed to start appearing. We also have what we call perpetuating factors. Perpetuating factors is what will now, once the problem has started, it could stop, but it aggravates. So that which causes it to aggravate is what we call perpetuating factors. But we also have what we call protective factors. Protective factors is anything that stops the problem from worsening. And therefore, when you ask what are some of the factors, some are actually environmental, some are life occurrences. And I want to give you a good example. When COVID struck us, we know the impact of COVID. That was a big factor that made people with predispositions to mental health actually get mental illness, actually get mentally sick because of the precipitator. The precipitator here was the COVID-19 and its impact. Sometimes things like loss and grief could actually cause a precipitation of a mental illness to someone with a predisposition. And that's why we need to be alive to this. But at the same time, we have got protective factors such as social support, such as early screening and early diagnosis and early intervention. All these are factors that we need to think about when we want to address this joint problem of mental illnesses and substance use disorders. You also said something, yes, in what we call the diagnostic and statistical manual that we use to classify diseases, mental illnesses, substance use disorders are actually classified as such. But we do not want to dwell on that for now. But the key thing we want to make people understand is that there's a big relationship between these two disorders, and we cannot work on one while ignoring the other. That's the reality. Thank you.
Thank you very much for that. Now, a report by NACADA last week revealed that drug and substance abuse is the primary risk factor for depressive disorders among users in Kenya. What can be done to help our youth who are in the pits of substance use condition?
That's a very good question. And I want to also say that research has shown that both mental illnesses and substance use disorders tend to occur towards late adolescence and early adulthood. And that is the age when we have our youth, especially those in universities. That then means that we need to have very specific mechanisms of addressing what we call prevention. We want to prevent as many people as possible from getting into substances or even from getting mentally unwell. And therefore, we say one of the biggest interventions that we can make, evidence-based, is coming up with prevention programs so that we reduce the numbers or the risks of young people getting into using substances, because by so doing, then we reduce their risk of getting into mental illnesses. So really that is one of the things we can do. And part of what we can do to do that is through mechanisms of what we call screening. You know, we can do screening of general populations the same way we get screened for HIV, we get screened for hypertension. So we want to see more screening around mental health, more screening around substance abuse, so that we can detect early, intervene early, and therefore improve the outcomes.
For a long time now, there has been this debate of which gender is most affected by mental illness. Is it the female or is it the male? Who, according to you, is the most affected and why?
Well, I think a lot of what we tend to see in the areas we are in, we see a lot of the male population. But at the same time, let us remember there's a lot of stigma associated with mental illness and substance use disorders. And therefore, when you're a woman and you're affected by either, we say being a woman in itself is a factor that makes you vulnerable, is a factor that, in a way, disenfranchises you. So even speaking about it, in fact, today, when we had the walk, one of the workers came and told me that she's actually a woman in recovery from alcoholism. And I was telling her we need to have more conversations, because when it is women that are affected by substance use, then even accessing help is a bigger problem. And so some of them may not even come out. So even in terms of reporting, it could be that we have significant numbers of women that are affected but are not even coming out to report about it because of the dual stigma.
Mm-hmm. You've mentioned that she came out to you in matters regarding being a recovering alcoholic. Now, alcohol is one of the most, a report recently released by NACADA also showed that alcohol is one of the most abused drugs in schools. What exactly are we not doing right that we should be doing to curb this alcoholism in schools, especially?
Well, I think it's a complex issue. One, because alcohol is a legal drug, unlike cannabis and others. Now, a legal drug means that you're free to take it, provided you take it within the law. So, for example, the law tells us you can use alcohol if you're 18 years and above. So, provided you're doing that, you're within the law. But here is the catch. We have a lot of social issues around alcohol. Alcohol in our culture is not only a part and parcel of our lives, particularly in our traditional cultures. Let me think about Kenya. In some of the communities in Kenya, when a child is born, people celebrate with alcohol. When there is a graduation, people celebrate with alcohol. When there is a wedding, at the end of it, there is alcohol. So almost every social, event, the culmination is use of alcohol. That means that culturally and socially, we are almost glorifying alcohol. That then means children have grown seeing that happening in their families. How then do you tell them that alcohol is bad? They watch you and they see that when you take alcohol, the mood in the room changes. People get excited and happy. How then do you tell them that alcohol isn't good? So we are saying, and evidence and research is telling us, if we have to succeed in fighting the challenge of alcoholism in our country and in our societies, we must think about family-based programs. Look at media. How much of alcohol marketing do you do? Show us these nice-looking people, and then you show us a bottle of alcohol. You bring this nice program, and it is sponsored by an alcohol producer, so at the bottom there, we see alcohol. So again, we have to do media-based prevention. We then have to do what we call school-based prevention, and we also have to do community-based prevention. So in short, what I'm saying is, if we want to make a breakthrough, every one of us has to come on board, and that's why in today's event, we brought everyone on board, and we wanted to say the issue of substance use and the issue of mental illness is not a prerogative for the professionals in the field. It is a problem of everyone, and everyone has something they can do, from policy makers to community agents to institutions. If all of us play our part, then we can see a difference. Thank you.
Well, now, you're observing the Mental Health Month in Kenyatta University. Do you do this every year? And if this is the first, what are you looking forward to at the end of your sensitization program?
Thank you very much for that question. I must begin by saying Kenyatta University is one of those institutions that has heavily invested in student welfare support. We have got directorates that are charged with the responsibility of promoting students' wellness, including the Directorate of Wellness and Rehabilitation, the Directorate of University Health Services, Directorate of Accommodation, Catering, Gender and Equity, amongst others. And the idea is we want to create an environment that supports our students to be able to successfully navigate university life and be able to graduate on time. Unfortunately, we are facing the threat that we see in society. Remember, our university is a representative of society. There are lots of factors out there, environmental, that pose a risk to increased substance use, increased mental health challenges. And therefore, it was the first time that we are celebrating that in Kenyatta University, and we launched it because we said we do not want this to be the actions being done to be of selected departments and selected directorates. We want to pull together every stakeholder in Kenyatta University and outside Kenyatta University to begin speaking the language of prevention, to begin speaking the language of promotive health, to begin speaking the language of treatment support and recovery support. And so we intend to make this hopefully an annual event, but much more than that, we are intending not to stop on this month's activities. We are already taking some of the activities to be, continuous activities. And I want to give you one good example. We are actually strengthening what we call support groups so that people who are already affected and they are in treatment can be in support groups that can support their recovery. But we are also wanting to take it further. We want to advocate for promotive mental health. That's to say, we want to begin to address some of the risk factors. We want to be able to ask ourselves, if people have faced loss and grief, if people have faced traumatic experiences, how can we put in interventions, working with Directorate of Wellness Services and Health Services and all the players in the university, Department of Psychology, Department of Psychiatry, how can we work together so that we put up mechanisms to do what we call early intervention? Because if you do early intervention, even if there's a risk factor or a precipitating factor, you can actually stop the perpetuation of the condition. So we want to build in more protective factors, want to bring on board everyone that is concerned. We would like to see lecturers in the lecture halls being able to see that there's something about this student. They don't come to class often. They miss on examinations. They are missing on lectures. What could be the problem? And we want to see someone taking the initiative to connect that student with a support system. We want to build what we call a recovery support system, where every student has an opportunity to thrive mentally rather than survive. Thank you.
Thank you very much, Dr. Beatrice, for coming through. That was our time regarding that was allocated to us to do the discussion on mental illness and mental health as a whole. We shall continue to be following up with the awareness week that you are having at the Directorate of Psychology and the sorts. Thank you very much for coming through. We shall be calling you here for such discussions. And do have yourself a good night, and thank you for coming through. We'll be back with more after this break.